Everyone, welcome back to my channel. So today I wanted to talk about medical discrimination. I've actually kind of put this topic on the back burner because it is a controversial issue, number one. Number two, I feel like I am poorly qualified to discuss this topic. Clearly, if you can see my face, I don't know if I'm actually the expert on any kind of discrimination. So, I kind of felt like it was not my place to discuss that. But, I recently did a video on, I think, like medical tourism and sort of what the target demographic is for that. And, you know, there are different types of discrimination. So it isn't just racial discrimination. There can be other different types. And when I started to think about that, I did come up with a few examples, that I've experienced myself and that I've seen others experience. So I believe we do have statistics, particularly on Black infant mortality or Black mortality as a whole here in the US. And I believe Black people tend to die more frequently in medicine than other nationalities. Now, I can't really speak to that because I'm obviously not Black. I am a person of color, but I don't look like one. So that's what I'm saying. That's what I mean when I say I'm not an expert in this and I really can't speak to it. But I did remember a story, something that happened to me several years ago. I'm thinking probably like 4 or 5 years at this point, where I really needed a medication. I needed some kind of a diagnosis to get this medication. And I went to a Lyme disease support group, and somebody there kind of pointed me in the right direction, said, hey, why don't you go see this hematologist at, I think it was like Cedars-Sinai or something like that, and he may be able to help you with this. So I trusted what this woman told me, and I assumed that because she knew about this doctor, he was someone that would help, or that helped, people in the Lyme disease community. I went, I saw him, he did some blood work, and then just kind of didn't, he sent me the results and didn't really want to follow up, didn't give me a referral to anybody. And I was just like, okay, like that wasn't much help. Coincidentally, I found a rheumatologist. I think also he's a Cedars rheumatologist. And I decided to see him because I think he had experience in prescribing this specific drug. Unknown to me that the hematologist actually referred a lot of his patients to this rheumatologist. So I didn't know that they knew each other. I just somehow found one, one through a support group and the other one through a, I guess a Google search or something. So I made an appointment with the rheumatologist, and prior to that, I guess he got like some of my blood test results and some of my records, and he saw that I had seen this hematologist, and he was kind of like that's weird, like he didn't refer you over to me, given that he refers a lot of his patients to me. And what happened, long story short, was that the hematologist essentially told the rheumatologist, hey, she's got Lyme disease, like, don't even bother. And I went in there looking for an autoimmune diagnosis. And I went in there earnestly. I wasn't lying. I wasn't trying to, pull the wool over his eyes. But he assumed that that's what I was trying to do. I was honestly looking for another diagnosis because I was not fully convinced. I've never been fully convinced that I have Lyme disease. My symptoms are not very like similar to other people that have Lyme disease. And I just knew. I was like, there's something going on here. Discrimination against Lyme disease patients is very, very common. So you can be discriminated against based on a previous diagnosis or even like a suspected diagnosis. Lyme disease is a big one. I've heard a million stories of patients even being physically pushed out of doctors' offices because the doctors just don't want to deal with them anymore, or they know that they have Lyme disease, or they're aware that there's something like that going on, and they just don't want to deal with it. And if you know anything about Lyme disease, it's not something that a rheumatologist should really go near, because they can make a person with Lyme disease even more sick. And I wasn't asking this doctor to do that. I was almost like getting a second opinion. I just did not want to bring up the Lyme diagnosis because I knew what kind of treatment I would get if I revealed that previous diagnosis. And unfortunately, somebody else kind of gave him the hint and almost made it seem like I was purposefully, trying to do something kind of tricky to get him to like fall for it or something. By the way, I did like three more years into the future, did receive a diagnosis for a rare autoimmune illness. So just because you have a previous diagnosis of Lyme disease, or say lupus, or any kind of autoimmune illness, doesn't mean that rules out something else. It's actually more common and more likely that you will have multiple diagnoses. And that was something that I actually saw when I went to this rheumatologist's office, is that autoimmune illnesses can sometimes, I don't know if they like trigger more illnesses or if they have some kind of domino effect, but people with autoimmune illnesses tend to sort of have multiple other conditions along with it. And he didn't tell me any of that. So there is that kind of discrimination. There is sexism as well. And I can't, I don't want to say that I was discriminated against because I'm a woman. Obviously, I have nothing to compare it to, because I was never a man before, and I don't really know anybody close to me, that's a male that's chronically ill. But one of the things that did happen after, shortly after this encounter with this rheumatologist, was I found a different primary care physician. So I went to a therapist. I was looking for a new therapist, actually. And I said, look, I'm struggling right now. I need a new therapist. I'm not getting anywhere with my doctors. And this therapist, she was a woman. She said, look, there's this doctor. And she was literally a primary care physician down the street from me. She was like 5 minutes from my house. She said, she's practicing again. And I believe she's taking new patients. Why don't you go ahead and see her? And so my primary care physician, I can't remember who my primary care doctor was before that, but now my primary care physician was a woman. My immunologist is a woman. I have one neurologist that's a woman. My urgent care doctor that I go see is a woman. My therapist, I have a totally different therapist now. She's also a woman. I have, I think, maybe 2 doctors that are still males. But as soon as I got this primary care physician she was an older woman, within a couple of years, I've received my second diagnosis for a rare autoimmune illness. It did take a little while, but I noticed a clear difference once I started seeing female doctors. I also noticed a clear difference when I go see my one male neurologist, where he's just like, quick in and out, doesn't really want to spend too much time. I don't know if that's because I'm a woman specifically, or if that's just because he's a guy and he's just like that. But I did notice immediately that things were different once I had a lot of female doctors. And so, I don't want to say that I'm imagining it, but things started to happen when I switched to kind of an all female or mostly female crew. Um, there is also ageism, and anybody that is chronically ill knows about ageism. We've all heard the very, very popular, "You are too young to be sick." You know, "I'm older than you, and I can still do this." Um, we've heard it all from our elders and older, even from our parents. And age does not discriminate. I mean, illness does not discriminate by age, and it's going to get you one way or the other. But a story that I have related to this, and for people that have been told over and over again, it's all in your head. I don't think, I'm seeing that that's not just specific to chronically ill people or people with like autoimmune illnesses or, Lyme disease. I believe that that's just becoming sort of like the dismissive, just get out of my office response for doctors. So I've done a video about my nephew, who was sick a while back, but I don't think I've ever told this story. So when he was around 3 years old, he's 6 now or 7. I think he's like 7. Um, when he was 3 years old, he started waking up in the middle of the night, crying. And he would just wake up middle of the night crying. I think he would tell, his mom, like, "My legs hurt" or something. And she was just like, I don't know, just go back to bed, or she would soothe him and take him back to bed. So finally she was like, "I got to take him to the doctor. Let's see what the doctor says." And without even suggesting any blood work or anything like that, the doctor was like, "You might want to just take him to a psychologist. He's maybe having some kind of an emotional problem. I don't know." And, my brother was not really thrilled about that response. He was like, he's 3 years old. What kind of issues could he be having, psychological problems? He's 3. But that's what the doctor told him. And, it's not going to cost the doctor anything or any more time to just run a simple blood panel. I don't know why he didn't order that, but he didn't. So he told them, "Find a therapist, take your son to a therapist." Again, he's 3 years old. He's a fresh human being. He's been on this earth 3 years. And so really, what could be the problem, right? So this situation continued. It kept going. He kept waking up in the middle of the night, complaining about pain. And I remember seeing him one day before they took him back to the doctors, and he was completely pale. I mean, I don't think I had ever seen, had no color in his lips. He was like laying on the floor, kind of listless. And, I was looking at him and I was like, that's weird. His lips literally matched the rest of his face. There was no color in his lips. And, it was just bizarre to me. That I could see that something was going on and that a doctor couldn't. So, my sister-in-law said, "We're taking him to the doctors again tomorrow. And I don't know what's going on." And so she took him to the doctors the next day. They ran some blood work and they told her, "You need to go to the hospital. He's got leukemia." So that's where you can see that ageism is a problem. Now, an older person, people are going to expect an older person to have all kinds of medical issues. For someone who's 3 years old, it's like, well, what could possibly happen? And as we know, leukemia is a very, very common childhood cancer. I think it is, the most common childhood cancer. And I often think to myself, what would have happened if the doctors just kept saying, like, "Look, he's he's fine, but just by looking at him, I was like, I can clearly see that there's something going on here. And I think that is just, it is a form of discrimination. It's like, well, he's little. There's nothing wrong with him. And, at this point, he needed multiple blood transfusions, and it was a very, very scary thing. And he's fine now. He's doing really well. So we're all grateful for that. But, that's, I think, one of the big issues that a lot of us with chronic illness face is that we're looked at as, you're too young to be dealing with this kind of thing. Or it's not that bad because you're young, you can handle it, right? A young person is stronger, they're more hardy. So you can deal with the illness better. I feel like that's sort of the mentality of some doctors. Whereas an old person is seen as brittle and fragile, and they may have something as common as diabetes, but they're treated like glass, because they're elderly. And, I don't think that those are necessarily accurate assumptions for doctors to have because, like I said earlier, one medical condition can lead to another, can lead to another, can lead to another. The longer you let it go, the worse it can get. So, you know, I can't speak to the racism aspect, but I can speak to these other things. These are my own personal observations, but I have heard it multiple times from other people who are sick, especially young people who are sick, that there's this constant like there can be absolutely nothing wrong with you because you're not old enough, or whatever. So it does exist, and it does exist even with really potentially fatal diagnoses like leukemia. I was actually shocked when that happened to my nephew because I thought to myself, if that happened to him, how many other cancer patients are being told that it's in their head, right? Because he looked, for the most part, looked normal, except his coloring. But there are, you don't look any specific way when you have cancer. I have an uncle with cancer right now who doesn't look any different than before he had cancer. So, I think judging it by the way that a person looks or by their age is kind of a pretty bad criteria, pretty inaccurate to judge a person's condition by what they look like on the outside. But that's, what I wanted to discuss when it comes to medical discrimination. I know that there are many, many other types. And like I said, I can't speak to some of them, but this is what I've experienced myself or what I've seen within my family. If you have any examples of your own, please leave them in the comments, or if you can think of any other different ones that I may not have touched on here, go ahead and leave them in the comments. I'm always interested in hearing what the different things that people experience, as far as, how doctors treat them, especially people of color. Like I said, I am a person of color, but I don't look like it. So that's been kind of one of those issues where I really can't, I can't speak to it, but I know statistics do show that people of color experience discrimination a lot more than white people. So leave your experiences down in the comments, like and subscribe, and I will see you again soon. Take care.